program here on AMP's Cable Channel 24 and on the internet at www.ampmedia.org. Join our rotating host and their informative guest live every Monday afternoon at 4 o'clock. The purpose of the Your Health television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm so very pleased you could be with us for this special edition of Your Health, because today we have the very distinguished guest, Dr. Eric Del Piero, eye physician and surgeon, and he's a retina specialist and expert. Dr. Del Piero, thanks very much for being with us.
My pleasure. Nice to be back here again.
Dr. Del Piero, before we get into what I wanted to discuss today, which is the anatomy of the eye, and we're going to try to teach our audience about how the eye works and how we get vision. It's really a miracle of vision. I want to talk about you briefly to review. I know that you were named Monterey County Physician of the Year, which is a great honor. That's an honor bestowed by your peers.
Very humbling and just a wonderful honor. That's right.
Well, Dr. Del Piero, we're very lucky to have you in town here and in this county. So you have an office in Monterey and one in Salinas.
That's
you see
correct.
Patients on both sides of the county. Now let's go over your training. Let's go over the training for an ophthalmologist again. Now I know you're a retina specialist and expert. Now, does that mean you did additional training beyond eye surgery and being a physician residency?
That is correct. Ophthalmologists go to 4 years of medical school just like any other medical doctor does. And then we do a 1 year of internship. Sometimes the internship can be a medical internship, and sometimes it can be a surgical internship. That's what I happened to do, was a surgical internship. Then the ophthalmologists will go to 3 years of ophthalmology residency training. And then if they're going to subspecialize, sometimes when I was doing my fellowship training, it was a year. Now most of those fellowship training programs are 2 years in length, because there's been a lot of new information, new developments, and new techniques which have come to be part of our normal armamentarium that we use every day in medicine over the last 20 years.
Well, Dr. Del Piero, I think one of the important points we want to make to our audience is that as a trained ophthalmologist, you could have opened your office, hung a shingle, and practiced as an ophthalmologist, but instead you went beyond the normal training and you're a specialist in the retina.
That is correct. That is absolutely correct. I was trained as a general ophthalmologist, and then I did indeed do an extra year of advanced training in retinal diseases and retinal surgery. And even at that time, it was a lot of laser procedures that we were doing as well, which were cutting-edge procedures at that point.
Well, Dr. Del Piero, that's a perfect segue to what I'd like to teach our audience about today. I'd like to review some anatomy of the eye itself. I'd like to go layer by layer, structure by structure, and let's talk about the function of each structure, and then we'll go back and talk about the common things that can go wrong and perhaps how we can prevent some of them.
Happy to try and help.
So let's start. I see you brought a model of what we call the eyeball, the globe.
That's
Is
correct.
That correct?
That is absolutely correct. And I did bring this model to be able to help the public understand what we're talking about. One picture is always worth 1,000 words. If you're looking at an eye in someone's face, for the most part, this is the image that you're looking at. The very front surface of the eye is called the cornea, and it is a very clear layer. In fact, it helps to focus light into the back part of the eye. This model separates into two pieces, and so I'm going to hold this up so that you can get a good cross-section of what the eye actually looks like. Again, actually, let me put this back on for just a moment. In addition to the cornea, what we look at, too, is the colored portion of the eye, and that is called the iris. Some people have brown eyes, blue eyes, green eyes, and that iris is very important from the standpoint of allowing a certain amount of light to come in. If the light is bright outside, the pupil will constrict. If the light is, or if you're in a dark situation, or at nighttime, the pupil will dilate to allow more light to come in.
Okay, so Dr. Del Piero, if I can interrupt you for one moment.
Sure.
We start with the cornea.
That's correct.
Now that's the very clear part on the most anterior portion of the eyeball.
That is absolutely correct.
Okay, so what's the function of the cornea? Why do we have a cornea?
Well, the cornea, because it is clear, certainly allows light to enter into the eye. It's the very first clear tissue that's involved in the structure of the eye that allows light to penetrate into the eye without being distorted, without having the wavelengths of light entering into the eye be pushed around. It directly focuses light into the internal structures of the eye. So it is all part of a focusing system, not terribly unlike what we would see in a camera. You have multiple lenses in the camera that help to focus the image onto the film of the camera, and the eye, quite honestly, works very similarly to that, and the cornea is the first lens that helps to focus light into the back part of the eye.
Okay, so Dr. Del Piero, when we focus on something, if I look at something up close, like the pen, and then I look at something across the room, is the cornea a dynamic structure, or is it quite static? Does it just stay as it is?
The cornea, for the most part, is static. It can change modestly in shape, but there are other portions of the eye that change that allow you to see up close and then immediately off at a distance. That process, by the way, is called accommodation. You accommodate to what you're trying to see, whether that is a near vision or a distance vision. So I can get into that a little bit more as we open the eye up and show you the rest of the tissues.
Okay, so
but if the public can just remember, the front surface of the eye is the cornea, that's clear, and the colored portion of the eye is called the iris. And they'll see that split in half section when I open the eye up.
Okay, so is there anything in between the cornea and the iris itself? Is that a chamber?
It is a chamber, and it is filled with a clear fluid called aqueous fluid. And the aqueous fluid provides a lot of nutrients and vitamin supplements to help maintain the tissue on the inside of the eye, to help maintain the cells in the tissue on the inside of the eye. Both the cornea, and probably most importantly the cornea, because the cornea is, for the most part, avascular. There are no blood vessels going through the cornea. Think about it. If you had blood vessels going through the cornea, it wouldn't be clear anymore. So you have to be able to provide a way to get nutrients, oxygen into that tissue to make sure that it stays alive. The aqueous fluid helps to do that, and then we also get perfusion of oxygen and nutrients from the blood vessels around the edge of the cornea that then will perfuse into the cornea and bring those materials that are so important for keeping the tissue healthy.
I understand. And my producer knows I love these segments when I learn a lot, and I can tell already I'm going to learn a lot in this segment from you, Dr. Del Piero. So we have the cornea on the very front of the eyeball.
That is correct.
Then we have some aqueous.
Aqueous fluid.
Aqueous fluid.
Aqueous humor is the correct.
Aqueous humor.
H-U-M-O-R. Aqueous humor. It's two words, and it is actually produced by the ciliary body, and I'll show you that in just a moment.
Okay. Now, is that what you call a chamber? Is that an anterior
It is the
chamber?
anterior chamber of the eye. That is correct.
Okay. And then we get to the iris.
Then we get to the iris.
And you said that the iris accommodates varying amounts of light greatly. It can dilate and
Yes,
it can constrict.
and it can constrict, both.
And isn't the iris how we get our eye color?
That is correct.
So we can have a blue iris, we can have a brown or very dark
Green.
iris. Okay.
And Elizabeth Taylor had a pretty unusual.
Right, almost violet.
That's right.
Okay, so should we open the globe and take a look on the inside?
So I'll take the top off, and I'll adjust this, and hopefully you'll be able to see this as well. So again, the front surface of the eye is called the cornea, and that's here. The color portion of the iris, we're looking at it in cross-section now, is right here. The anterior chamber that we talked about is where my pen tip is going into, so there's actually a space there. Behind the iris is a structure called the lens.
Okay, the lens.
The lens.
Now, we hear about the lens a lot, don't we?
Sure you do, because as time goes by, the lens will become more opaque as we get older, and then it's called a cataractus lens, or a cataract for short. This is what is removed when cataract surgery is performed.
Okay, so when it gets sort of opacified, that's another word for cloudy, right?
Correct, that is correct.
Instead of being crystal clear, absolutely crystal clear, it becomes sort of, as you said, opacified or cloudy.
That's correct.
And when that
happens, we talked about the cornea focusing the light into the eye on a straight shot. The cloudier the tissue is, the more diffracted or broken up light becomes as it tries to enter into the eye and penetrate to the retina, which is in the back part of the eye. The more spread out the light becomes, the more glare a person gets, the more blurry the vision is, and the less clear the image is, because it's like looking through a piece of wax paper, or more like looking through a dirty windshield. Light will come in, but it's not coming in as clear as if that windshield was clean.
Dr. Del Piero, when we hear people talk about they have difficulty seeing at night, or they'll see the street lights or the moon and it has a ring around it, a cloudy ring or a colored ring, is that because there's a problem with the lens?
Most typically, yes. There can be other issues related to that. But that is the most common, one of the most common complaints of patients that patients have when they have cataracts is seeing a halo around lights, or having difficulty seeing at nighttime, or oncoming headlights from a car causing them to be flashed out or glared, or get severe glare to the point where they don't feel safe driving at nighttime.
Okay. Now before I asked you about the image or the light focusing on the back of the eyeball, which is the retina.
Yes.
Now, is it the cornea or the lens that is primarily responsible for accommodating, as you say?
It is the lens.
So if I'm looking at something up close, like for example this pen, as compared to looking at something far away, that's the lens?
That is the lens that changes, and it's part of the autonomic nervous system. It works automatically. We don't have to do anything. The body recognizes that you're trying to look off at a distance, and it will automatically try and place the lens in such a position to give you the best visual acuity at whatever distance you're looking at. Now, I will tell you, and most people are aware of this, once you start hitting 35 or 40 years of age, people start looking for their reading glasses. And that's because as people get older, the ability to accommodate, to be able to see close and then see off at a distance decreases. Why does that happen? Well, there are lots of different reasons, but suffice to say for the public to hear this for the first time, the lens itself becomes less elastic. And when it becomes less elastic, the muscles that are responsible for changing the shape are pulling on tissue that won't change as much. And usually that occurs when we start getting over the age of 35, 40. Some people as late as 60. There's always a range, and everyone's an individual, but that is typically what happens.
Now, Dr. Del Piero, is there a muscle around the lens that makes it change shape or focus?
The iris sphincter is what helps to change the size of the lens. There are very fine fibrils that are connected between the iris and the ciliary body, which I talked about before, that actually creates the aqueous fluid that goes in the anterior chamber. And that is connected to the lens, and that is responsible for either pulling on the lens and flattening it out, or releasing the traction on the lens and allowing the lens to thicken up.
Okay, so before we go on, I just have one more question for you. Actually, I could sit and talk to you for hours, Dr. Del Piero, but when someone finds that they need their reading glasses because the lens isn't so flexible, that doesn't mean that they're getting a cataract, correct?
Not necessarily.
Okay, so that's...
Although for the most part, people over the age of 40 will have some type of cataractous change. It's like saying, do you get wrinkles and gray hair over the age of 40? Everybody does. Not everyone gets them all at the same time. Some people get them worse than others. But the fact of the matter is Father Time is taking his toll.
Okay. And we'll talk about plastic surgery a different time, Dr. Del Piero. So we've talked about the cornea. You told us about the anterior chamber has aqueous humor.
That's correct.
Then we get to the iris. That changes size, constricts and dilates with light, a different light. Then we got to the all-important lens.
Yes.
And how that focuses. So what's in back of the lens?
Behind the lens is this large cavity, and this is called the posterior segment. We had the anterior chamber. A lot of times people, if they've had cataract surgery, will hear about having a posterior chamber lens put in. When the cataract is removed, a plastic implant is put in the place of where the cataract was, and that's called the posterior chamber. So in the anterior segment, there are two parts, the anterior chamber and the posterior chamber. Behind the lens is the posterior segment, and this is filled with a jelly-like material called vitreous. It too is absolutely crystal clear in a normal situation.
So that's the vitreous.
Yes, and the vitreous is very important up until you're about 11 or 12 years old. It's important from the standpoint of the growth of the eye. After about the age of 11 or 12, the eye really doesn't grow very much anymore, except in pathological situations. It may change slightly in size, possibly in shape, but the growth of the eye, for the most part, stays exactly the same. Now, I can relate that to you. If you take a look at small children, their eyes typically will look a lot bigger.
Right.
And as the people get older, their heads get bigger, but their eyes stay about the same size.
Okay.
Okay, so that's the reason why children many times will have much larger eyes in comparison to their head.
So that's the vitreous that's in what you call the posterior segment.
Posterior segment, and the vitreous is here. And after the age of 11 or 12, it really doesn't do a lot until you're probably 50 or 60 years old. Early on, the vitreous is a gel. It moves like Jell-O. As a person gets older, that gel begins to liquefy. And once you get to be in your 80s, most of the time it's almost completely liquefying.
Okay. So as we move posteriorly or further back, and I can't believe how the time is flying, in back of the vitreous
is the retina. That's this clear layer that lines the posterior surface of the eye, and it's shaped just like a cup. It is a direct extension of the brain, and all of the nerve cells that come through the optic nerve, which go back and are attached to the occipital lobe of the brain, result in these nerve fibrils going through the retina and lining the back surface of the eye. This is the film of the camera. This is the most important structural entity in the eye itself.
Okay, now Dr. Del Piero, I've got to wrap it up. Unfortunately, we're going to have to bring you back another time. But I know that you just got back from the American Academy meeting, and one of the most common pathologies involving the retina, isn't that macular degeneration?
It is, and in fact, I did get back about 3 hours ago from Orlando, Florida, where the American Academy of Ophthalmology was holding its annual meeting. There's a many times can help to delay or retard the progression of age-related macular degeneration. But we're also finding out now that it's not just vitamin and mineral supplements. There are also lots of other nutraceuticals, if you will, that may be added to the vitamins that may help to prevent macular degeneration from progressing. Macular degeneration, the new concept is it's not just age-related. It can also be hereditary. And that hereditary aspect is an inflammatory aspect. And what we're trying to do now is not only stop father time, but we're also trying to decrease the inflammation. And there are lots of different interesting ways to do that. And I would love to be able to come back and tell you about some of the new research that's taking place.
Dr. Del Piero, we've got to get you to commit to a date. I'd love to bring you back. I think you're an excellent teacher.
Be happy to do that.
I've just got a few seconds. I want to give out your contact data. This is Dr. Eric Del Piero. And you have a website, MontereyEye.com.
That is correct.
2 words, but it's all together, MontereyEye.com. Your phone number here in Monterey, 831-375-5066.
That's right.
You also have a Salinas office for convenience for that side of the county, 424-1150. That's 424-1150. Dr. Eric Del Piero, you're a specialist in the retina, eye physician and surgeon. Monterey County Physician of the Year. Thanks so very much for being on the program.
My pleasure. Always nice to be here.
Please come back again.
Be happy to do that.
I'm Dr. David Morwood. I am a board-certified plastic surgeon, and this is Your Health television program. We're coming right back after a very brief pause for a very good cause.